Hi, and welcome back to our channel. This is going to be video number 1 in a 3-part series on celiac disease and gluten sensitivity. I wanted to do this series because I know that a lot of people out there, and maybe even your doctors, have been saying that you don't have to avoid wheat and gluten unless you truly have celiac disease. But what the science is showing, and what I've seen in clinical practice, is that there is a whole spectrum of gluten intolerance that can manifest in so many different ways. If we aren't looking at gluten as a possible contributing factor in our health problems, then a lot of things get missed. And as we go through this series, you'll see just how many sneaky ways gluten intolerance can manifest itself. So in part 1 today, I'm going to be talking about what gluten really is, and what is the difference between food allergy versus a food sensitivity, and what is true celiac disease. I'm also going to talk about the many ways that celiac disease and gluten sensitivity can manifest as symptoms, and also what are some of the major complications. So even if you don't think that you're at risk for celiac disease, I encourage you to watch this series because I'm going to cover some topics that might still be relevant for you. First, let's talk about gluten. What is it? We hear this word all the time. It's kind of a buzzword. Gluten is a protein found in wheat, rye, and barley. These grains are in the same branch of the grass family, so it makes sense that they have similar components. Now, normally when we digest protein like gluten, it gets broken down into individual amino acids, which are the building blocks of protein. However, gluten is a very large and hard to digest molecule. It's very resistant to our digestive enzymes, and most people do not digest gluten very well. And when that happens, when the gluten protein isn't fully digested, is that we're left with a fraction of the protein called gliadin. So gliadin is a part of the gluten molecule. The problem is that some people develop an immune reaction to the gliadin portion, and that leads to inflammation and destruction of the intestinal cells. Now, not everyone is susceptible to developing this immune reaction in their intestine. You have to be genetically susceptible, and there has to be a breach in the intestinal barrier that allows the gliadin to get into the intestinal lining. A healthy intestinal lining is our first line of defense against bacteria and other foreign particles in our food and from water. We also need a little bit of inflammation in our GI tract because that's how we fight off infections or prevent them from taking hold in the first place. But in the case of celiac disease, the inflammation gets out of control and the body ends up attacking its own intestinal cells. We have a special enzyme called tissue transglutaminase that's found in every tissue of the body. It helps to hold our proteins together, and it plays a big role in wound healing as well. But in celiac disease, gliadin causes the body to make antibodies against its own tissue transglutaminase. That's the glue. So if a person who is genetically susceptible to celiac disease keeps eating gluten, and then the gliadin gets into the intestinal wall and stimulates that immune response, that inflammation cycle just keeps going and going. And eventually the intestinal cells become really damaged as innocent bystanders. The body doesn't think that it's attacking itself. It's actually trying to protect us from something that it thinks is a foreign invader from food. But the constant immune response destroys our own tissues in the process, and the intestines won't recover until the cycle of inflammation is stopped by removing the trigger, which in this case is gluten. So just to recap, celiac disease is an autoimmune reaction to gluten in people who are genetically susceptible. But what I want you to really understand is that celiac disease is actually a multi-system disease that affects every part of the body, even though the inflammation starts in the gut. And that's a really important concept to remember, because as we go through this video series, you'll start to see just how broad the symptoms of celiac disease can be, and that some people have no digestive symptoms whatsoever. There's a reason that 97% of people with celiac disease never get diagnosed. Okay, so I'm guessing that a lot of you out there are wondering, why is gluten such a problem now? Nobody really talked about gluten until the past 10 years or so. So why are we having so many problems with it all of a sudden? Well, a lot of it has to do with the way that the agricultural industry has hybridized and crossbred wheat to make it resistant to things like drought and fungus. Also, they've made some genetic changes within the plant to maximize the yield per acre. They've made the plant shorter and more rigid and more compact. And so over the past 50 years, we've had thousands of new strains of wheat in our food supply that have never been tested for human safety. Well, why does this matter? Because whenever we start modifying the genes in plant foods, we end up with a hybrid plant that has unpredictable effects when we eat it. Also, the modern strains of wheat have a higher quantity of genes for the gluten proteins that are specifically associated with celiac disease. Now, obviously not everyone has celiac disease, but there is absolutely something called non-celiac gluten sensitivity, which does affect a lot of people. And all of this is on a spectrum. On one end, a person might have very subtle symptoms like eczema patches, difficulty concentrating, or abdominal bloating. And on the other extreme, a person with gluten sensitivity might have a severe neuropsychiatric disorder like schizophrenia. Now, I don't necessarily believe that gluten is a serious problem for everyone, but it is certainly a problem for a lot of people. And when it is a problem, it is a really big problem. However, it is important to know that gluten increases intestinal permeability, or the leakiness of the gut in everyone. It's a universal response, and it also has a really significant effect on raising blood sugar. So if you're eating a lot of wheat and gluten, you're ultimately making yourself more vulnerable to developing inflammatory conditions down the road. And I just don't believe that we were meant to eat wheat and other grains in the quantities that most people in modern times are consuming it. I want to take a minute to briefly explain the difference between an allergy versus a sensitivity. First, understand that celiac disease is not an allergy. It's an autoimmune disease, meaning the immune system is making proteins called antibodies that cause the body's own tissues to become damaged. A true allergy means that your immune system is responding to something with IgE antibodies. An antibody is a protein molecule that the body makes to help fight off pathogens, and those antibodies bind to a target. So when a true food allergy is happening, the body is making IgE antibodies in response to something that should be harmless, like a food. The reason that these true IgE allergies can be dangerous is because the IgE molecules cause the release of histamine, and it happens almost immediately. I'm sure most of you have heard of histamine before, especially if you suffer from seasonal allergies or pet allergies. You may have even taken antihistamine medication. Histamine causes all of those classic allergy symptoms like watery eyes, itching, sneezing, hives, and swelling. And if the swelling is happening in the mouth and throat, it can quickly close off the airways and be fatal. We call this anaphylaxis. However, a food allergy can cause symptoms anywhere in the body because the allergen gets circulated through the blood. So just to recap, a true allergy is mediated by IgE antibodies, and it's usually more of an immediate response. Food sensitivity is really an umbrella term for any adverse reaction to food, not including psychological aversions to foods we just don't like. So whereas true allergies are mediated by IgE antibodies, the so-called food sensitivities are mediated by something called IgG antibodies. The IgG antibodies are associated with a wide variety of symptoms, and this reaction is considered to be delayed, meaning you can eat the offending food on a Monday and then get a migraine on Friday. And that makes it really hard to tell what the offending food was because we've eaten so many other things within that time frame. It's not quite the immediate response that we typically see with the IgE-mediated allergy. This is why I really do like to test my patients for food intolerance, because I have seen a lot of improvement with things like migraines, eczema, and fatigue when I have them remove the foods that show up on their tests. Okay, let's talk about the symptoms of celiac disease and gluten sensitivity, because there are so many, and I really believe that this is why a lot of people are underdiagnosed. Obviously, if there's inflammation going on in the GI tract, a person with celiac disease or gluten sensitivity might have abdominal cramping, diarrhea, constipation, gas and bloating, and even acid reflux. But I want to make it very clear that fewer than half of people with celiac disease have any sort of intestinal symptoms. That's interesting, right? We think of celiac disease as a gut problem, and there is certainly intestinal inflammation going on, but that intestinal inflammation causes body-wide symptoms. So there is such a thing as silent celiac disease, where people have no GI symptoms whatsoever, but they may notice things like fatigue that won't go away, or irritability, especially in kids. Sometimes even diabetes or anemia can be manifestations of celiac disease. And in fact, about 10% of people with type 1 diabetes also have celiac disease. That is a much higher percentage than what we would expect to see in the general population. In children, hair loss or short stature can be the only symptom. Fecal incontinence, or not being able to feel or control bowel movements, can also be the only symptom, especially in children or the elderly. Also, painful menstrual periods and depression are incredibly common symptoms. There are skin manifestations. One skin condition called dermatitis herpetiformis is considered diagnostic for celiac disease. This is a red, blistery, extremely itchy rash that usually shows up over the shins, knees, elbows, and buttocks. Also, vitiligo, which is a loss of skin pigmentation, is associated with celiac disease, and some people have even restored the pigment in their skin by following a gluten-free diet. Now, believe it or not, neurological symptoms are a much more common manifestation of gluten intolerance than GI symptoms. So if a person has bipolar disorder, seizures, migraines, depression, uncontrolled movements, it's a really good idea to rule out celiac disease. I'm going to link to a research study in the description box that actually explains those mechanisms of the neurological piece. It's also important to understand the role of malabsorption in causing a lot of these symptoms and complications. Malabsorption means that the gut is not able to absorb enough nutrients because the cells have become too damaged. And most commonly, people with celiac disease can become deficient in iron, calcium, folate, and also the fat-soluble vitamins A, D, E, and K. These nutrients are crucial for energy production, immune health, bone health, and so many other functions in the body. So you can imagine that if you're lacking the basic tools that your body needs to function, it can cause a lot of problems. Mouth ulcers and neuropathy are common because of B12 deficiency, and osteoporosis can be a major complication because of calcium deficiency. Everybody reacts differently, and there are literally hundreds of symptoms that can be associated with celiac disease or gluten sensitivity. And there's a reason that celiac disease has been called the great pretender, because as you can tell, the symptoms are all over the place and it can mimic so many other health conditions. So that leaves us with the question, how do you know if you have celiac disease or even gluten sensitivity? Be sure to join me for part 2 of this video series, because I'm going to get into the nitty-gritty about how celiac disease and gluten sensitivity can be diagnosed. The diagnostic criteria are a little bit controversial and it's not very black and white. So I'm going to be talking about the different blood tests and biopsies and also the important genetic markers. Thank you so much for watching, and be sure to subscribe and hit that like button if you enjoyed this video. Have a great day, and I'll see you in part 2.